What's up, ladies and gentlemen? Thank you once again for joining us. My name is Eugene. Eugene does hair, founder, creator of Lady St. Lucia Lashes. Angela with us, and of course, the wonderful doctor who is going to go over something different today called PDO Threads. What is it? Where can they be used? What's the procedure? Talk to us, doctor.
Okay. Hi, everybody. Thank you for listening. What is a PDO Threads? What is that? Why we call it PDO Threads? PDO Threads we call it. Actually, I have one in here. Like this is a small one, and basically it's a polydioxanol sutures. These sutures right now that you see over here. I'll show you here. Can you see over there those sutures in there close by? Can you see them?
Oh, bring
like
it.
that.
Yeah.
Is it like that?
Yeah.
So basically, the sutures we use, those are polydioxanol sutures. And basically we use it for open heart surgery. So what it does, basically, it's those sutures are very safe. They've been in the market for more than 40 years. And we use it in here to lift the face, basically, to lift it. So those sutures in there, they're like kind of, they have some like anchors, so they stick to the skin and they lift the face.
Okay.
So, and basically those sutures, they are, while they are under the skin, they get dissolved within 4 and 6 weeks. So basically they are not just, they lift the face, but also they build your own collagen. So, so what we call them basically right now, we call them non-invasive facelift, or non-invasive, facelift, surgery, whatever you want to call it. But it's basically how you do it. You go through here, those needles, of course, you put locals in there, you put some locals in there, and you go with those sutures in your skin, and then you lift. And those sutures inside, they have some, you can't see them, but they have some anchors. It's like, anchors in there. So they stick to the skin and they lift them. Actually, when they lift your skin, so basically the first thing you see is just 10 to 20%. But as those sutures, they stay in here and they get dissolved. So as they are dissolving, they build your own collagen. So it's just like it's stimulating. It's like the tissue repair around them. It's just like, for example, just give you an example. When you go for surgery, or for like open heart people surgery, they stitch those valves, whatever it is. And with times, those sutures, they disappear or they dissolve and they repair the tissue around them. It's like every surgery you go to. When you go for surgery, they stitch.
Yeah.
And while those stitches are dissolving, your skin closes. So instead of they close outside, those sutures, they stay inside, they lift, and they build your own collagen.
So I have a quick question. What is, you have the PDO threads, and then they also have what you call smooth threads, correct?
That's right.
What are the differences between the PDO and the smooth threads?
Yeah. The PDO threads I just showed you, all of them are made with polydioxanol sutures. So the sutures are different. There's the barbs one, which is the anchor one. They stick to the skin and they lift.
Okay.
So beside they build your own collagen, they have two things. They lift because they have those anchors in your skin. They lift your skin. Plus, they build your own collagen. For example, the smooth one, they don't have those barbs. You just put them in there. They're a small one. Just put them, like, for example, in your neck or something like that. But they don't lift. You just put them in there. You leave them in there. They build your own collagen. Let me show you, for example. So let me show you the example of that. For example, give me a second. I will give you in here, and I have them in my office. Like for example, yeah, like those small ones, for example. You see those ones in there over there? Those are like tiny ones, those smooths. They're just very tiny. So basically you just put them in here. They are small sutures. Basically you put them in your neck, you put them in some areas to build your own collagen. They don't have barbs as the regular one I showed you, the big ones. But what they do, they basically, you just put them in there and they build your own collagen. You put them in your neck, you just like, you just put them in there. They're small one, you can't see them. They're in here, very tiny one. You can't see them. And basically you put them in there and they build your own collagen. For these big ones in there, you see they have barbs. I'm gonna put out this. And you see they are big and they have barbs. If you touch them, you feel that they have barbs in there. And that's basically when you put them in there, in your skin, they lift. Plus, when they stay in there and they build your collagen, they have both, building collagen and lift. The smooth one, it just you put them there, they don't have lift, they just build your own collagen.
Okay, so I would assume that PDO threads are probably, would you say, more popular than the smoothing threads?
Well, the PDO threads, remember, the PDO threads, all of them are called the PDO threads.
Okay.
It's just the PDO threads, they have the barbs, which they leave. So the PDO threads, they have different ones. All of them are made from polydioxanol materials. Some of them, they lift, we call barbs, and some of them, they don't lift, they just build your own, we call the smooth. That's the difference between the barbs and the smooth ones.
So you as a doctor, when your clients come in, do you have more clients asking for the ones that lift, or the ones that just kind of create more collagen?
Well, like I say, usually the indication is mine. The clients that come to you is like, so for example, if you put like something in the neck in here around this area, for example, you want something build collagen, there's nothing to lift around this area.
Right.
So, but in the face, yeah, you can use something to lift. But there are some areas in your face, there's nothing to lift. Like people have some wrinkles, they want to build their collagen, you just put some smooth, to get rid of those small, tiny wrinkles in there to build collagen. But also, like if somebody comes and say, "I want some lift," then I use the barbs.
Okay. So
it depends the area what you want to use. Some areas you just want to do smooth, especially the neck. Some areas you want to lift, you use the barbs.
Okay. Now this versus an actual surgical facelift, obviously this is non-invasive. It's very little to no downtime for this procedure. What are the benefits of the PDO threads over an actual surgical facelift, other than the fact that you're actually going through surgery and there's downtime?
That's right. Well, the PDO threads are done for like young girls, like in their 40s, like kind of, save some time for facelift. So for example, the girls, they're young, they're not ready for facelift. They're still young, they look good, but they just want a little bit some tightening, some skin rejuvenation, some build of collagen. So this is the best indication for PDO threads. A young girl, she has a little bit of jowl in here, she want to lift it, that is the best indication. The reason why, because before in the past, there is some young girls and they start facelift in their 40s. The idea of the facelift, well, it's not told to people, but the facelift doesn't last forever. It lasts for between 5 to 10 years, max 10 years. And the reason why, as we get older, our anatomy changes. Our skulls get some osteoporosis, our ligament, start getting loose. So the facelift that you do in 40 years, your face is not the same as 45 or 50 years old. Right. So it's like whatever your skull, your face, it's different. The facelift that you done in 40 is not gonna last because your anatomy changes, your face changes. Like I say, muscles and ligament, bones, all that, get some changes. So if you start early, then how many facelifts you need? Like 4 or 5? That's gonna be a lot because every time you do facelift, surgery, they cut your skin. So there is no, if you want to go to the next, facelift surgery, you don't have much skin to play with. So basically you compromise yourself if you start early with facelift. Mm-hmm. That's why these PDO threads, it's amazing, because as younger, you start with PDO threads are nice, you build your own collagen. Then later on in your life, like when you hit like 70s or whatever it is, and you want to go for facelift surgery, at least you can go. But starting early, it is not a good idea. And that's the reason why, because facelift, you may need a lot of them, and you may end up by really not having much skin or much, maybe like kind of not looking good if you do like 2 or 3 face surgeries. That's what happens. Some celebrities, they do so many, face, surgeries, and they end up not looking good.
Right. So the PDO thread lift is essentially when you're younger and you just want to tighten up your face a little bit, essentially prevents you from having to get
face, yeah, and like, face surgery early on in your life. And like I say, if you start early, you get harder and harder, because, in facelift surgery, probably you don't want to have more than max is 3, because like, you cut, because when you do facelift surgery, you cut in your skin, you cut in your ligament. Then if you go to the next one, you don't have much to play with. So these PDO threads, makes you look great, makes you look good, and buy time for you till you are ready for face lift surgery. Before, in the past, people didn't have that choice. They have some problem, I want to go for surgery. Oh, I have this, I want to go for. Right now in our time, we have a lot of things. We have lasers, can do skin rejuvenation for you. We have PDO threads. We have a lot of things to do that they can carry you on till later on in your life. Then if you want to go for surgery, you can go for surgery.
Now, doctor, because I know that the recovery time is a lot shorter than like a traditional facelift, because it's non-invasive. Yes. What is the recovery time for something like this?
The recovery time, actually, it's amazing. It's like basically most what you can feel after they do PDO threads is some kind of a little bit of swelling, a little bit of pain. People max their recovery in 1 week. But, I can do like, thread lift, and you can go work the same day. There is nothing going on. The only thing, my clients, they feel a little bit of pain, a little bit of swelling, a little bit, but people, they don't realize what you have done. It's just like, for example, people, they can come to me, they call it lunchtime facelifts. I don't know if you heard about that. Lunchtime. Okay. Yeah. You heard about lunchtime facelift. So people, they can come and they can get like facelift, and they can go and work. That's what's amazing about this procedure.
How long does it take to do? I mean, if it is done is it like an hour procedure, or what is it?
Of course, all it depends on the skills of the one, the technique and the skills of the, the doctor that doing this procedure for you. So, most when it takes me about between 30 minutes and 45 minutes. So basically, about 30 minutes, 45 minutes max, and also depend how much you wanna have. If you wanna have one area, because in the face there is what we call, there is 3 areas. We do like the upper face in here. That's one area. We do this, the middle face, and then the lower face, which is your jaw and the upper neck. So depend how many areas. For me, be honest with you, I have to do some locals. The time I do anesthesia on locals, it takes me about 10, 15 minutes. So every area will take me about 10 minutes. So altogether about 45 minutes. Wow. But if I want to do just one area, it's about 30 minutes.
Okay. So last time I had asked, and this was pertaining the fillers in our last episode, what I was asking about the skin around the knee. And I know a lot of women are very weird about the wrinkling of the kneecap. And you actually said that you can treat that with the PDO threads too.
That's right. That's right. Actually, the threads, you can use it everywhere. Actually, some people use it even their chest.
Really?
Lifting their chest, yes.
Is so boobs?
Yeah, lifting their chest. Wrinkling? Yeah, the wrinkling, and also you can lift your chest a little bit with we use PDO threads everywhere. We use it like that. We use it in the knee, like calf. You can use. So we're using basically the PDO thread everywhere you can use it. So and you can lift, like the chest. You can use the knees. You can use everywhere. Yeah. And it's a good indication. The thread's a little bit bigger, a little bit of harder, but definitely you can use them everywhere. And also when we use them, remember, we use them also to build your own collagen. So it's amazing. It's amazing tool to use them for everything else.
That's incredible. I actually didn't. I did wonder, but because the PDO threads that I've seen are so small and
No,
I was
every,
almost
like for
wait-
example, every threads, like for example, there is small threads using for this area, bigger thread they're using. So the threads, they come in different, different sizes,
uh-huh.
like, like also the different like diameters. There is like kind of, if you want to pull too much, they're gonna get bigger. If you want to pull just a little bit smaller, so it comes in different sizes, depend of the area you want to treat.
Now, how long can they expect if say, just generally, how long on an average would the thread lift actually last?
Yeah, well, supposedly to last for 2 years, but
Okay.
I have my clients, sometimes they come with touch up, but
Mhm.
supposedly to last for 2 years.
So is it basically different for a lot of people? Some would need touch-ups throughout
Well,
time.
definitely, there is some people, they have saggy skin, kind of loose skin more than others. So probably they need more kind of threads. Probably they depend. Like some others, they don't have much saggy skin, and they don't need even a touch up. So
Mhm.
depend of, like I say, everything is different. Like you have too much loose skin, you need more. You have a little bit, you need a little bit. It's up. It's like I say, it's different, but supposedly to last for 2 years.
Now, what are ways that people at home can minimize how fast it wears out? Like, are there things that they should or should not be doing to help it last?
Well, like I say all the time, and like your face. I don't know myself. I'm not. I sleep on my side. Well, I don't know. Like, but people, if they can sleep in their back, in their back, that probably is the best way to kind of, because when you sleep on your face and this, you can pull the press down. But if you sleep back on your back, it's good basically for, if anybody can sleep just on back, don't sleep on the side. It's really good for your, for gravity, good for your skin comes down, they last longer. So yeah, I think that's the best advice I can give. If you can sleep on your back like that, if you get to sleep on your back, not sleep on your sides, that probably will be a good idea.
So JLo has like a special pillow that she sleeps on where she can't move her head.
Okay, so probably tell me, Angela, I didn't know about that. I need myself. Probably I need that. Yeah, I think that's the best for gravity and for get your skin, saggy skin is because you put a lot of pressure in your skin,
Mhm.
especially at certain age. We don't have much collagen in our skin, so when you sleep on your side, it does shows up. Especially you guys, you can see when you wake up in the morning, you can see your face. Bah, oh my God, it takes me a long
Oh
time
man.
to get my face like get back, and that tells you your face was snatched the
Yeah.
whole night on like in that. So you wake up and you face, oh, that's my face. Like sometimes it happens to me.
I
So
sleep
it's kind of, yeah.
I sleep on my side, and when I wake up I have like this big old crease on the side because my face
That's
is
right.
all,
Yeah,
yeah.
that's right.
I try to
So
sleep on my back. It
what? That Angela just told us there is a Jello sleeves on that. You're gonna text us the Angela. I need to
I'm gonna
buy
have
that
to
one.
call JLo and get one of those pillows. Maybe
You
she
can
can send
find
me
them
one.
on Amazon. They have them on Amazon. They're like 70
Yeah,
bucks.
yeah. So now, Angela, I swear to God, I love it. You know what? It's good. I hate sleeping on my sides. Like when I wake up in the morning, it's like my face all snatched, like poof, like with that thing.
Honey, you have
Yeah,
pillows.
that's right. And Eugene, that's my advice to everybody. When they do threads, probably don't try to like sleep on them.
Okay.
It's amazing.
So now, doctor, I am. If somebody gets this done, can they also do other services that same day, or like, can they also do any laser treatments that day if there's surface issues, or is this something that can only be done that day? Can this be combined with other services?
Yeah, that's a very good question, Eugene. Very good. So be honest with you, I did like for my girls, I couldn't do Botox, has nothing to do with the threads. I do
Okay.
fillers, has nothing to do with the threads. The only thing probably I want to do with the threads, like radio frequency, some heat, because the heat can make them dissolve very fast. You know what it is.
Okay.
So I have just a lady today. She's like, she feels a little bit of pain in here with, I just did have threads last Saturday. And just like feeling a little bit, and then just put some heat on her to just dissolve a little bit radio frequency heat. So you don't want to do something heat like to dissolve the sutures. That's what I can tell you. Like something,
Okay.
any radio frequency, anything like that. I don't think like, for example, lasers, all lasers, but I would probably just stay from radio frequency. That's like radio frequency, like the heat. But I
Because
use, sometimes they feel pain. I use radio frequency and it's, you know, it's good.
Because I feel like most people would want to go in and like maximize their appointment time, right? And they're
I
like,
agree
hey,
with
I'm
you.
here.
I agree. What I
What
do,
can
like
we
for
do?
example, I can do sometimes like radio frequency first, then do the threads afterwards.
Oh.
Like I'm sorry.
Oh, there we go.
Yeah, I just like that. Yeah, I can just do the threads and I do like the radio frequency, then do the threads afterwards. But I don't want to do like, you know, threads and do radio frequency. Sometimes it can dissolve the sutures, so I stay away. Like today, like I say, one girl came to me, just a little bit of pain in here, just did radio frequency, she dissolved whatever it is. She was happy, everything was good at the end of the case. Beautiful.
Okay.
But you can do Botox, you can do fillers, and you can do threads at the same time.
Awesome.
All right. Well, this is definitely information I think people are going to be interested to know, especially our age group of our friends and our moms.
Your
friends
age group.
and
Not mine. I'm kidding.
listeners.
I'm older.
Oh, Angela. But hey,
So
Angela,
audience
how old
out there
Angela?
that doesn't know us,
21.
I'm older than
Angela.
Angela, so it's a joke. People.
Angela look like 21 years old, Angela.
I do. That's because you took care of me. I'm 37.
Angela, 37. You look amazing, Angela. You look like a
Thank you.
baby. You look like a baby.
that's what I'm hoping.
But Asian, you get a good genes though.
We're
Asian get
okay.
good genes. Like you are like
Yeah.
you don't age. Asian don't age. I don't know what's good about you that you don't age.
I don't know. I've spent a lot of time in the sun as a child, and my
Yeah.
skin used to get really dark. And one of our conversations you said last time is all of that sun exposure and the environment damage catches up to you later in life. And so that's what I'm really afraid of, that when I was running around now super dark and tan all those years, and another 10 years, it's all going to show up at the same time. So I'm trying to pace myself and really like, you know, so that's what I always joke around about friends. Like one day you look 25 and then when you're 84, you literally just look 84. So I'm gonna look 21 until I'm 84 and then just one day look 84.
But you know, can I tell you, Angela, I got a lot of clients.
Uh-huh.
Really, they look amazing in their 40s than they look when they look in their 20s. They look, you know, I see their pictures. They look much better in their 40s when they look there. So actually the look right now, the 30s and 40s is like kind of, it's amazing look. Like, you know, they showed me when she was 21. I think it's sometimes as you get older, you get that finesse. You look better, you look good, better than when you are like 21. So actually, in fact, 30s and 40s has become like, look at Jello. How old Jello right now? Is 50 something?
50 something, yeah.
50.
So she looks amazing at that age. And you know what? Right now, I see clients coming to me. They look better and better with time. Actually, the age, I'm not telling you, the ages catch up with you, but it's amazing when you look in your 40s. That look of the 40s looks more mature, looks like nice, looks beautiful, and I love it. Then I look like a kid, or a girl looks like a kid. It's very different. But it's getting harder and harder with time. Like people look harder as they get older. That's my question to you. That's my answer to you, Angela. So if you are 30s, it's like that's like probably your prime time to look good.
I feel like I look better now than I did in my 20s anyways.
That's what I'm saying.
That's kind of the goal. I mean, I struggled a little bit the last couple of years, but after just kind of having worked with you and just getting everything, you know, aligned again, like it's been a very positive experience so far, even with just my face and, you know, the diet that you just had me on, which is absolutely incredible. So just overall, I feel really good about.
Well, thank you so much. Thank you, Angela.
No, thank you.
I'm waiting for Eugene to come over, but he's a busy man.
Well,
Eugene is a busy man.
Let's close this down real quick, and then we'll talk more about that anyways. But Doctor, thank you so much for all the information today. We're going to have all your contact information at the end of this video and under this video on YouTube, so people can reach out and get those appointments booked with you. And if you're watching this and you have any questions for us that you want us to address in an episode, please message us, comment, and we will keep providing you guys the information as you keep asking us. So thank you very much, you guys.
Thank you, guys. Thank you. Thank you, everybody. Thank you so much. Thank you.